Hello there again from us at Nicopure Labs. My name is Patricia Kovacevic. I'm the General Counsel and Chief Compliance Officer of Nicopure Labs. And today I would like to share with you some information about two new guidance documents that the Food and Drug Administration has issued right around the time when it issued its Deeming Rule, or I should say since the issuance of the Deeming Rule. And you will have noticed that FDA has issued more guidance documents. However, the two documents that I'm going to discuss are important for the following reason. The compliance date for the first one, which is registration and product listing for owners and operators of domestic tobacco product establishments, is due by December 31st of this year. So we barely have a couple more months to comply with that requirement. The other document, the other guidance document, Tobacco Health Document Submission, has also a relatively short deadline for compliance, which is February 7th of 2017. So without further ado, let's talk a little bit generally about FDA guidance documents. FDA guidance documents indicate FDA's thinking and interpretation of the Tobacco Control Act, in our case, or of a statute in general, and the way FDA may apply that respective section in the statute. However, FDA makes it abundantly clear that guidance documents are really not binding. The conundrum there is that if you do not comply with FDA guidance document, FDA may get back to you and basically say that you have not complied with the statute. So the fact that FDA on their disclaimer page states that guidance documents are basically optional should not mislead you. You really have to be very familiar with all FDA guidance documents and follow them as closely as possible. In my experience, FDA in the past has gone beyond requirements in a guidance document, and therefore guidance documents sometimes are almost just a floor rather than a ceiling for FDA compliance. So the first guidance document that I'd like to discuss, registration and product listing for owners and operators of domestic tobacco product establishments, basically requires under Section 905 of the Tobacco Control Act that every person who owns or operates any domestic establishment engaged in manufacturing regulated tobacco products must register under Section 905B of the Tobacco Control Act. And every registrant also must file a list of its regulated tobacco products. Of course, an owner or operator may authorize a third party to do so. However, FDA has a strong preference for the owner basically that acts as an agent for operators within a business structure to submit information. FDA really does not like redundant submissions. Now, of course, newly deemed products are tobacco products, and the first deadline for that registration is December 31st, 2016, which is this year. The guidance spells out who has to register, as you've heard before, but also what information is submitted as part of the establishment registration and product listing submission. Section 905B of the Act sets forth the requirements for submission of the establishment registration information. And that includes the name and full address of each establishment engaged in manufacturing that the registrant owns or operates as of the date of registration, and also the name and place of business of the owner or operator. There is, of course, a little bit more detail in case there is a partnership or if there is a corporation, you have to include the name of each corporate officer and director and the state of incorporation. The registration and listing electronic submission system and the paper form request additional optional information that FDA also recommends to be submitted, such as an email address to facilitate correspondence between the registrant and FDA, and the DUNS number, Data Universal Numbering System number, or some other unique identifier of the business. Also, together with the facility registration, basically every registrant, meaning every domestic owner or operator of a manufacturing facility, has to list its products. So we had a lot of questions about what happens with importers. Aren't importers also defined as manufacturers under the Tobacco Control Act? And the short answer is yes, they are, but not for purposes of this particular guidance. For purposes of this particular guidance, only those owners and operators of manufacturing facilities located in the US have to register their facilities and list their products. And their products arguably only mean those products that are manufactured in the registered facilities here in the US. So if you only import products and if you do not engage in further labeling or repackaging of that product in the US, in that case, you do not need to list those products under this guidance. The same with foreign manufacturers, they at present do not need to register themselves under this guidance document. However, FDA has indicated that it will issue guidance or even regulation that will describe what happens to foreign manufacturers and how they must register. FDA does inspect foreign manufacturers in other regulated industries, and for sure FDA is aware that a large chunk of the vaping industry, which is basically the newly regulated industry, is comprised of manufacturers that are located abroad, or at least there's a lot of importers of foreign-made products. Here at Nicopure Labs, of course, we don't have that problem. We own and operate our own facility, but I know that many of you may just be importers. A retailer that imports products directly from overseas is also an importer. But again, for the purposes of this particular guidance, if you do not engage in further manufacturing here in the US, you do not need to register. Now, product listing, it sounds very complicated, but FDA does provide a template as to how that product listing must be conducted. And basically, it also, in addition to the name and some other information about the product, such as unique identification number and so on, you also have to attach a copy of the product labeling, and as well as a representative sample of our marketing and advertising that is related to that product. And again, we get a lot of questions if a representative sample means all advertising. And the short answer is no, but you should really conduct your own internal evaluation as to what a representative sample means. You may want to look at the channel of communication or type of advertising. Certainly it has to be by product. And bear in mind that FDA at any time can ask for additional samples of your marketing materials that have not been submitted. More importantly, the registration, basically the establishment registration information must be submitted by December 31st of this year, and then resubmitted annually on or before December 31st of each year. That has to do only with the facility registration. Why does FDA need that? Well, FDA needs to know where to inspect the tobacco product manufacturers, and therefore the establishment registration basically provides FDA with the address and the responsible individuals that FDA will encounter during their future inspections. However, the product listing is due every 6 months. The first time is going to be December 31st, 2016, and then at the end of June, and then end of December, and so on. So the question is, if I haven't changed my product portfolio, which really today is a clear, it's a certainty in terms of new products. We really cannot introduce new products without pre-market approval from the FDA, but you might delist some of your products that you manufacture. How do I proceed? Do I have to resubmit the entire list every 6 months? And the short answer is no. In terms of just strictly the product names and the list of products, you only need to inform FDA about any differences between your initial product listing and subsequent changes. So if you decide to delist a product, stop manufacturing it, you would need to update and inform FDA and basically delist it by the next submission cycle, which let's say will be next June. However, in terms of your marketing materials, of course, it is likely that you will create new marketing materials in the next 6 months, and then every 6 months thereafter. And therefore, a good practice is to choose a cutoff date, perhaps December 1st and then again June 1st, and collect a representative sample of all your marketing materials in the 6 months period to that date, and basically submit it to the FDA during your submission cycle, which will be December 31st or June 30th, basically every year, every 6 months. The marketing materials need to be updated. It is truly a cumbersome exercise, but when we start engaging in that exercise, we realize that if you keep track of your marketing materials for approval purposes, as we do, it really is not difficult to collect your representative sample of marketing materials. Generally, it is good to establish an internal procedure that mandates that all newly approved marketing materials that go out into production, that go out in the world, if you wish, be classified and maintained immediately in a structured form so that it makes it easy to submit that material or those materials to the FDA during your basically semi-annual product listing. So what happens if you fail to register your product, your facility, or list your products? Well, that basically makes your products adulterated and possibly also misbranded, but definitely adulterated. And you really will have an issue with the FDA because FDA may order you to either correct that or take your products off the market. So in conclusion, with respect to this particular legal requirement, I think it's very important that you comply with it in the best possible manner and also by the deadline. One other note about the means of submitting the registration and facility registration and product listing. FDA has an e-submitter tool, an electronic tool to do that. In my personal experience, that tool has crashed a lot of times when I was trying to use it. It doesn't mean that it doesn't work. It does. It's just you have to be perseverant, I suppose. And maybe in the meantime they've fixed the problem. However, you also have the option to mail through regular mail to the FDA a hard copy of your establishment registration and product listing with the respective marketing materials, or you can put it on any medium such as a disk or a flash disk to mail it to the FDA. I would, however, allow for a few days for the delivery of the package or find some other secure form to send it to the FDA. They will not take it by email, partly because it's likely to be a large document with all the marketing materials, and therefore I would send it by recommended mail or FedEx and make sure you get a confirmation of delivery from the FDA, and definitely do that. Make sure that it is actually received before the deadline. That is the discussion about registration and product listing. The other guidance that I wanted to discuss today is a revised guidance document that was initially issued in 2009 called Health Document Submission Requirements for Tobacco Products. And truly, that requirement stems from Section 904A4 of the Tobacco Control Act, which in pertinent part provides that each tobacco product manufacturer or importer or agents thereof shall submit to the Secretary the following information. All documents developed after such date of enactment of the Tobacco Control Act that relate to health, toxicological, behavioral, or physiologic effects of current or future tobacco products, their constituents, including smoke constituents, ingredients, components, and additives. So, first of all, who must submit the health documents? First of all, you have to identify them, collect them, and then submit them. And then we're going to talk about what period is covered in this guidance and how you can proceed to collect these documents for future submissions to the FDA. So basically, for products made in the United States, the submission has to be made basically by the manufacturer. For products made outside of the United States, health documents for tobacco products that are or will be imported are to be submitted by either the foreign manufacturer or by the importer of the product. And the foreign manufacturer and the importer must work together to ensure that these documents are collected and submitted to the FDA as required. So basically, FDA really requests a bunch of information. It's all spelled out in the guidance. And of course, you can read it. Generally, there's going to be information about the business, about the facility that manufactures the products. If an importer makes a submission, you also have to discuss where the products were manufactured and so on. So the question is, what kind of documents have to be submitted, and how does FDA interpret health, toxicological, behavioral, or physiological effects of the products? So FDA interprets health, toxicological, behavioral, physiologic broadly to include, for example, cell-based, tissue-based, animal or human studies, computational toxicology models, information on addiction, intentions to use, cognition, emotion, motivation, and other behavioral effects at both population level and individual level. So first of all, you have to conduct an internal investigation to see if you have any of these kind of documents, which would include, basically computational toxicology models or information from your consumers about their patterns of use, motivation to start using the products, and so on. And once you've identified if there are any responsive documents, then you have to collect them, and then you have to submit them. Basically, at present, FDA also spells out documents that do not need to be submitted. Basically, FDA does not request that you turn over or collect documents that are exact duplicates of another document that has been included in the same or prior submission, or redacted documents where an unredacted copy of the same document is included in the same or prior submission, any articles published in peer-reviewed journals, and some other public information. So if there are articles and information that is public, you don't need to submit that because, of course, FDA has access to that. Basically, FDA also requests that you're required to organize and label the documents, and really, that I think is the most onerous part of this exercise. Here I sort of disagree a little bit with FDA's interpretation of the statute, but you should seek your own advice, of course, as to how those documents have to be organized. In any event, it is clear that the documents have to be saved in file formats that FDA can readily process, read, or archive, which could be PDFs, plain text, comma-separated values, rich text format, and so on. Basically, there are more information about file formats in the FDA eSubmitter user manual. The eSubmitter is an online tool that FDA usually requires regulated industries to use when sending FDA information. Now, the deadline for the submission really is soon, February 8th. I correct myself, I said February 7th. Or at least 90 days prior to the delivery for introduction into interstate commerce of a new tobacco product. But clearly, at this time, we're not looking at any new products to be introduced on the market. So the first deadline is February 8th, 2017. And moreover, although the statute requires ongoing submission of health documents, at this time, FDA requests that you submit health documents developed between June 23, 2009 and December 31st, 2009. So June 23rd, 2009 to December 31st, 2009. So of course, many of you may not have been in business, but you should still conduct your own internal due diligence and see if such information about your current products is still available in-house that may have been developed during that period of time, and that may have been developed by the manufacturer, and so on. But if you don't have in your possession that information, certainly you're not obliged to go out there and find it. So it's only about documents that you've developed and are in your possession at present. So the Of course, many companies that were in the business before were required to maintain all these documents, but in theory, if you were not regulated before August 8, 2016, it is very difficult for you to have really known or collected such documents in the past. However, again, you should conduct your own internal due diligence, make sure that nothing falls through the cracks. In the future, of course, you have an ongoing obligation to retain those documents that are responsive to this guidance, and therefore it is a wise approach to implement a standard operating procedure or some internal policy that will make sure that all such type of information and documents are collected, and that they're kept in a safe repository, ready to be disclosed and sent to the FDA when FDA requires it. And FDA is likely to issue future guidance at a future date to discuss these health documents. Now, if you're a small company and if you don't have a lot of health documents, that's going to be an easy exercise. Bear in mind that for a large manufacturer, for instance, large manufacturers of conventional tobacco products, this exercise can result, this document production exercise can result in probably many hundreds and hundreds of thousands of pages, if not millions of pages of documents. For conventional tobacco companies or conventional cigarette product companies, of course, those documents will have been disclosed in litigation most likely, but it can be a very onerous requirement. For the newly regulated industry, certainly there can be a lot of documents, but I expect that it will be manageable at least for the 6 months period that FDA requires from June to December of 2009. So because the deadline is coming up soon in February, my advice is that you should start conducting the internal due diligence, ensure that you have, or if you don't have any responsive documents from the period from June 23, 2009 to December 31, 2009, you should say so in a letter to the FDA. If you find the documents, of course, you should organize them as the guidance suggests and send them to the FDA before that date. Again, FDA has a strong preference for electronic submission through e-submitter, but other forms of submission are acceptable also by mail. This concludes our webinar for today. We hope you find this information helpful. As always, we're looking forward to sharing more news with you, and thank you for your time and attention. Have a nice day.